I'm Dr. Mo Som. I am a professor of internal medicine at Oklahoma State University Center for Health Sciences. I have been involved in training medical students and residents for at least 15 years.
I'm Dr. Jason Beeman. I'm the chair of psychiatry and behavioral sciences at Oklahoma State University Center for Health Sciences. We constantly strive to have our physicians and our medical students recognized around the state and around the country as having above board professionalism. And several years ago, we kind of felt like we weren't meeting that goal.
It's the number one reason physicians will actually end up in front of their respective state boards is because of a lack of professionalism. You'll see that manifest early on in their career during years 1 through 4 while they're being trained in the classroom, as well as when they're getting trained during residency.
Dr. Som and I decided in discussion with our administration that a lot of our unprofessional behavior stemmed from the way that we talk to each other, and that if we could just change the way we speak to one another, that we could probably institute a culture shift, not only at our medical school and our hospital, but throughout the state where all of our doctors go on to practice.
We received our training for Crucial Conversations back in 2016. I recognized that this could really revolutionize how interpersonal communication and professionalism is taught in an academic setting. We turned around and we implemented the training in 2017. We started with the chief residents, and the impact even during that course led us to believe that this was going to be truly changing as far as the face of Oklahoma State University Center for Health Sciences. When we had gotten into the training, we conducted a survey before Crucial Conversations, and then we conducted a survey, same survey, after Crucial Conversations training. What we wanted to see was, is this tangible? Is there something that we can actually look at? Is there something that we can actually speak to and actually measure that shows that Crucial Conversations actually has an impact in the healthcare environment? And the areas that we ended up finding that the survey actually showed us that there was an impact was workplace environment, stress recognition, and ability to communicate. And it was statistically significant.
Even in the course itself, you can see them kind of relax and kind of soak it in and start looking at each other and realize, well, now wait a minute, when I come to OSU, there's a little bit more expected of me in the way that I treat people and the way that I talk to people. We start out by telling them that this curriculum is for the healthcare setting, but it's going to help your marriage, it's going to help your relationship, it's going to help your relationships with friends and family.
We'll receive information from many of our graduates, whether it be our medical student graduates or our resident graduates, on how it's really fundamentally changed the way they approach individuals and really have gotten a tremendous amount of accolades for their professionalism in their workplace setting.
Some of the most important feedback we get is that people realize that a crucial conversation is about to happen. And so they're just slowing down, they're taking deep breaths, and they're approaching that conversation with intention and purpose. And we avoid a lot of conflict just because they recognize now that they're having a crucial conversation. We spend so much time, money, and intention in healthcare with like big inventions and blockbuster medications trying to keep people alive longer. And really, we just got to talk to each other better. And if we pay attention to the conversations that we're having, we can actually save lives and get better health outcomes. And that's what we've done at OSU Center for Health Sciences and OSU Medical Center, and honestly believe that people are living longer because the healthcare providers are getting along better.
For us to grow in our small community here in Tulsa, Oklahoma, and continue to spread that into larger communities and into our nation to improve healthcare, it has to start with communication. We are proving that every single day, and I think that Crucial Conversations has a big role to play because we know how to have difficult conversations. We know how to focus on the things that are important, which at the end of the day is the individual's healthcare.